challenges and solutions. The theme that we embark upon today resonates deeply with the core principles of sustainable development and universal health equity. Hypertensive disorders of pregnancy represent a significant global health challenge, affecting millions of mothers and their unborn children every year. Despite progress, we find ourselves at a pivotal juncture as we strive to achieve the Sustainable Development Goals by 2030, particularly in the realm of maternal and newborn health. Disparities in the management of hypertensive disorders of pregnancy in Africa stems from a complex interplay of various factors, and these include limited access to healthcare services. This leads to delayed diagnosis and inadequate management. We also have health infrastructure challenges with shortage of trained health professionals and medical supplies. There's also the socio-economic factors, poverty, lack of education, which contribute significantly to discrepancies and disparities in healthcare access and utilization. We also have the cultural and social norms, and this may influence healthcare seeking behavior and decisions during pregnancy. Throughout this symposium, we aim not only to understand the existing disparities in the prevalence, diagnosis, and management of hypertensive disorders of pregnancy, but also to explore the multifaceted challenges impeding progress in this domain. Furthermore, our collective endeavor is to identify innovative solutions and best practices that can be implemented globally to ensure equitable access to high-quality care for all pregnant individuals, regardless of geography, socioeconomic status, or ethnicity. As we delve into this critical dialogue, let us remain mindful of the lives and futures at stake. Let's channel our expertise, passion, and commitment towards forging tangible pathways towards a future where hypertensive disorders of pregnancy no longer pose a threat to maternal and newborn health. Together, we have the power to effect meaningful change and build a world where every pregnancy is characterized by safety, dignity, and optimal health outcomes. I urge each and every one of you to actively participate, share your insights, and engage in constructive discourse throughout our discussions. Through collaboration, compassion, and collective action, we can indeed transcend the half point of SDG 2030 and pave the way for a healthier and more equitable world for generations to come. On that note, I'd like to welcome you all to the beautiful campus of Kwame Nkrumah University of Science and Technology, which is rated the best in terms of quality education in the whole world. Thank you very much and welcome.
That was a very holistic remark. I don't know which one to say and which one to leave out. He was exactly on point. He has urged us to actively participate. Would want to do some acknowledgement.
I just want to quickly add that Prof is also the Dean of the School of Medical Sciences. Yes. Thank you so very much, Prof, for that enlightening speech. At this point, I also want to acknowledge the presence of Dr. Tim Crime, who is the Regional Director of Health Services for Ashanti Region. Shall we put it together for him? Doc, you're welcome. We also have in our midst the presence of Dr. Rita Reindorf, who is the Deputy Director for Clinical Care for Ashanti Region. Shall we put it together for her? Yes. I have also seen seated at the back and trying to hide Dr. Edward Dassar, a gynecologist and a member of the School of Public Health, KNUST. Doc, you're welcome. Yes. So as we move on, we shall be doing further acknowledgements as and when we get the updated list. Thank you.
Thank you very much. So I'll be your conductor. We'll clap in a particular way. We call it one mom. One mom. When someone is here, mom, you'll be clapping. One mom. When I say sodoe, sodoe means join. Sodo, join, join. Then when you hear oye, it means stop. So let's see who will get it. So we'll take it. I think we'll do it. When you see me doing this, it means I'm pointing to you. When I do that, it means those are the back only. Then when I say sodo, it means you have to join. So one mom, 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 one mom. Here, one mom, one mom, one mom, one mom. Sodoe, 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 sodoe. One mom, one mom, one mom. One mom, sodoe, sodoe. Oh yeah. Somebody didn't. When you hear oh yeah, it means stop. So let's do it for the last time. 1, 2. One mom, one mom, one mom, one mom. Sodoe, 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 sodoe. Oh yeah. Somebody stopped before I said oh yeah. Okay, thank you very much.
Right. So at this point, we'd like to take solidarity messages from our partners and our stakeholders. And we'll start with a solidarity message from the sport study.
One mom, one mom, one mom, one mom, one mom, one mom. Sodoe, sodoe, sodoe. Oh yeah.
Thank you so much, bro. Sure.
Thank you. Good afternoon again, ladies and gentlemen. And let me say that I'm indeed excited to be invited to give a solidarity message. The birth of the Sport Consortium also occurred around the same time that this organization, APEC organization, was formed. So we've been working together. I remember their first outdoor program was done at the Greater Accra Regional Hospital. I stand to be corrected, but their first outdoor program was done at the Rich Hospital, and we have since been working together. The sports study is looking at, originally was giving birth, looking at what is it to try and validate some of the protocols that was being used elsewhere, the PS protocol, for example. But then, since the birth of the Sport Consortium, so many other things currently are being done. And we have been working, as I said, with Kwewa and her group. I want to use this opportunity to thank her for the opportunity to work together. It's been an exciting moment, and we believe that a time will come she'll get her baby, but APEC will continue to exist. The fact that she gets a baby does not mean that APEC come to an end. APEC will continue to exist. That's our prayer. We thank the good Lord for a day like this. Thank you.
Thank you very much, Dr. Shroff. We'll take a solidarity message from a rep from the Ministry of Health, if they are here. Ministry of Health. Okay. Nobody from the Ministry of Health, so we go to Konfuanoche Teaching Hospital. There's a rep from Komfo Teaching Hospital. Okay. And then we go to, okay, no Wombom for now. KNUST SMS. There's a rep from KNUST SMS. Solidarity message. Okay. SPH. Yes. Wombom, 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 Wombom. Sodwe, 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 Sodwe. Oh yeah. Thank you so much, Dr. Dasayo.
Thank you. Thank you very much. So on behalf of my dean, Professor Sam Newton, and then the School of Public Health, KNUST, we are very excited and privileged to be associated with APEC Ghana Symposium on Preeclampsia. And the School of Public Health primarily focuses on training postgraduates, both at the master's and PhD level. And we train the health force, particularly in research, and even in some parts for postgraduate training in obstetrics and gynecology. And one of our focus has to do with reproductive health, the department that I head. And obviously, maternal health is one of the key issues there. And maternal mortality is key, and preeclampsia or hypertensive disorders of pregnancy is a leading cause. So we are very excited to be associated with this, and we are hoping that by the end of this conference, we will develop preventive strategies or agree on some of the preventive strategies to be able to prevent preeclampsia. Whatever we do, some of them will need treatment, and I'm sure some of all those issues will be discussed. So we wish you a very pleasant and academic conference. Thank you very much.
Thank you so much, Doc. I would invite Professor Alexander Terrier to give us the solidarity message from CAT. Thank you.
So I'm giving a message for Komfo Teaching Hospital, KNUST School of Medical Sciences, Ghana College of Physicians and Surgeons. So I'm wearing 3 hats, and we are all excited to be here because we know, as has been said, we are trying our best to reduce the abnormal impact, not the positive, but the negative impact of hypertensive disorders of pregnancy on our women in Ghana, West Africa, Africa, and globally. Last year, we had this conference in Accra. The auspices of the Ghana College of Physicians and Surgeons. It went very well. We were hoping that since the first conference started in Kumasi, the 6th conference should come to Kumasi, and it has come to Kumasi. So I clap for that. The only a bit of negative this is that the crowd is not what we expected. So we'll try and make sure that the crowd is bigger tomorrow. Komfo, as has been said by the Dean of the School of Medical Sciences, is the receiving center for all the complicated cases of hypertensive disorders of pregnancy, not only in the novice sector, but from the middle zone, from Nkoko up to Wa, and they've been coming and becoming and becoming. Thank God the case presented by the Dean was a success story. Most of the cases are success stories, but as you know, preeclampsia is a deadly disease, and we keep losing some of them, especially when they come with complications like HELLP syndrome. So, Koewa, we thank God for your life. We wish you had had your baby, but in obstetrics, we know that even though we want both mothers and baby to survive, if by fate, F-A-T, by fate, one should go, the baby should go for the mother to survive. Because the mother can give more babies. And Kwewa, I promise you that you get the baby called Ghana Kowa baby that you are looking for. Stroff tried his best. It didn't work. Next time you go to Stroff, or you come to me, it will work. Say amen to that. So, Ghana College is trying to train as many consultants and specialists as possible to help in managing these cases. In fact, and also educating mothers, just like APEC is doing. Confanote is doing the same. Medical school is training doctors and training specialists for the same purpose. So on behalf of the college, the medical school, and CATH, I say that we are excited to be part of this special symposium. And we'll put in our best to ensure that whatever we come out with will also assist in its implementation. God bless us all. Amen.
Thank you very, very, very much, Prof. In fact, a thought came to mind when Prof. Odoi was speaking. Koiwa, with your permission, we may have to name or use the name Koiwa to represent any woman that has preeclampsia. And Prof has said it. They've trained several gynecologists to try to help treat or prevent this condition. And they are doing just that. So it's not just you. All other women that have similar predicaments. And all the persons that Prof and the team from the Ghana College and West Africa College has trained to save these women are Shroff. And every single day, baby Koiwa is born from preeclampsia. So that would continue to be a success story for the college and for Ghana. Thank you so very much. Right. So at this juncture, we'll have a very short interlude. We'll listen to a key audio. Yes. So kindly.
Hey, sister Kosia, yin say na fata wo say yi. Hey, una sing na tata wani mu aye ma na wonsa de. Aya kese. Mitimu se ukunu show na yin say yin su de afata wo na. Hey, sister Kosia, yin say na fata wo say yi. Hey, una sing na tata wani mu aye ma na wonsa de. Aya kese. Mitimu se ukunu show na yin say su de afata wo na simi wo nsoso sa na o say ye
anio yin say de wa ye kese afen so ta fefefefe
se na ne ho ayefe hwese ne ananimu na e shrine wa hwe wa ye kama ho ayefe papa yin say fatal
eh mo de mo bebu o ho no ma ya na metie me ya eto de bia e ba na ekọ na bi so ho a meni su timi chi me kakra na me yefu su timi me kakra but yesi sa na yin sentie enche bia ni nyina su betwa na me ba na ba
akosia bra kwa me yire no wetwa hwe yesi ade ni kwa yaresabia sensem a mukeka wa ha ni nyina no e na na eye no yin sen ni mo yen kwa yaresabia sesia yen kwa hwe yediem.
Mr. Boating, medawase se one antia kosia aba yaresabia. Severe preeclampsia eye nyinsen mo yare bia eye apemfo efri bosomenum eko yare yi ema moja broswo na ebetumi amama me no abofra no ana omomienu nyina ahwere wo monkwa yare yi ema apemfo no enim ne nan ene ne nsa ana ne honam nyina honhon ema etipaye eya woni yem obehu ade mienu anaa n'ani so bɛyɛ ne nhyerenhyeren sɛ woanyɛ ho hwee a ɛsoro betumi aka no sɛ wonim ɔpemfo bi a nneɛma wei a mabɔ so yɛ na to ne fo sɛ ɔnkɔ ayaresabea ɛnkɔ hu doctor.
Dam nkratoi wana was the Preeclampsia Initiative. Na Ministry of Health so was one sashase.
Thank you so very much. So this video was produced with a lot of great assistance from Efua Sapon Foundation. And in fact, watching this video, this is actually my first time I'm seeing a video graphic of such nature in Twi. And I am so excited thinking of this message being replayed at our various antenatal clinics to educate mothers. And we say a very big thank you to APEC and to the Efua Sapon Foundation for producing this video for local consumption. For our foreign guests who probably could not pick the tree that was spoken, when we see a woman who is pregnant with the swollen feet and then the generalized swelling, you know, the other women actually feel excited. They feel the husband is taking really good care of this woman. You know, you are fat in all the very, very good areas. So they are congratulating her and saying, wow, your husband is doing so well. Look at the way you are all, you know, swollen. This man must be, we'll get him another wife. You know, but they don't appreciate that this is a woman on her way to developing with all the attendant severe features that it may come with. Right. So
the interesting thing I saw about the video was the fact that it was a male who was able to point out to the other women that no, these are not good signs. We have to send her to the hospital. It means we cannot talk about preeclampsia without involving the males. They really make decisions. They influence decision making, and it's very important that we involve them.
So, thank you all so much, and thank you again to the Efua Sapon Foundation and APEC. At this juncture, we'll watch a second. We'll have our first presentation, which is on home-based assessment and cover varied sources of lead exposure among children in Ghana. Mr. Ensa, Esmond Kwanzaa. Shall we put it together for him? Yes.
One bomb.
One bomb.
One bomb. One bomb.
Sodwe. Sodwe.
Sodwe.
Sodwe. Sodwe. Sodwe. Oh yeah.
Hello. Mr. Chairperson, Madam Kewa, I stand on the existing protocols and to thank everyone for making this possible. I bring you greetings from Pure Earth, Ghana, and we are glad to be part of this symposium to share some of the findings which may have some sort of linkage to the preeclampsia menace. Control, can you put my presentation up for me? Great. All right. So let's go. Let's start. So Pure Earth, as formerly known as Blacksmith Institute, it's a non-for-profit organization. We focus our programming on environmental health. We are headquarters in New York and have presence in 25 countries. We're dedicated to the pregnant women. So our programming is structured to focus on women, pregnant women, lactating mothers, and children. We partner government agencies, civil society organizations to work together to address some of these issues that confront our world. Next. So just a brief overview about what lead is. So lead is a toxic metal found naturally in the environment and also through the activities of man. Lead is a neurotoxin that has adverse health effects. Lead, some of the sources of lead. Lead is identified as one of the top 10 toxic substances. And they also emphasize that the need for active measures for vulnerable groups are lead poison. Lead is the most damaging pollutant. The 3 point a bit concerning for there's widespread lead exposure and poisoning among children in Ghana. And these studies were carried around areas that has toxic pollution. So in Ashanti region, for example, we focus on Bremine. There is an abandoned U-lab, an informal lead recycling, and I think in Tribrohum, and Greater Accra, the industrial areas, and the northern regions. So the elevated blood lead level appeared to be driven by both the industrial pollution and 90% of the mothers that we surveyed. Even some women also use these eyeliners, Chilo, which was the black, and there are no U-lab or used lead acid recycling plants in that area. So what could be causing the high blood lead levels? I think the Ghana Health Service kept asking that we probably conduct what we call isotopic analysis to actually see the attributions of which particular pathway is contributing more. One other finding is that our local cookwares that is saying, I know most of you might have heard that on the news. I think last year we were on the news a lot when we came out with the study. 77% of the cooking pot that we assess contain lead concentrations above the recommended levels. In Ghana, we don't have any standard, but we use the US standard. And you'll be shocked that some of the cookwares measure as much as 26,000 part per million. That is the concentration. How this local that is saying is manufactured, you understand why there's lead in it. Because usually the scrap dealers, car engines, everything is put together, heat it, turn it into liquid, and then, so if there's a little tiny contamination of lead on any of this metal, it quickly may cause a lot of problems to us. And then we also discover industrial pollution as one of the areas where this lead issue is. We've also conducted another study. In fact, it has just been published 2 weeks ago, a scientific report on rapid market screening. What we also did is to focus on the consumer product. We went to the markets, purchased the designs, the cookwares, ceramics, anything that we have access to that children actually use. We discovered that in Ghana, for example, 55% of the metallic foodware, or the design, 55% of the cooking pot that we tested reveal higher concentrations of lead in them. Ceramic foodwares, about 18%, toys, 14%, and cosmetics. You can find this report currently online. Rapid Market Screening Study 2023 by Pure Earth. Next. So from all this, what we decided to do with UNICEF and Ghana Health Service is to put together an action plan, a declaration against lead poisoning in Ghana. I think it was a document that was well received. We presented this document to the outgone minister, Dr. Jimamenu, I think just before he exited office. They were very alarmed with the findings, and so they quickly asked the technical committee of the Ministry of Health to quickly meet Pure Earth and UNICEF to find solutions to implement this study. This is also available online, and you can have access to it. Next. So our recommendations of addressing lead exposure in maternal health. In other countries that we operate, like Bangladesh and India, we actually conduct what we call baseline or blood level testing in pregnant women to actually ascertain if there is lead poisoning in the blood. I think it's something that we haven't done in Ghana here. So it's a huge opportunity to start a health surveillance among pregnant women to understand the prevalence, the severity, and the location of the exposure. Two, once we know the blood lead levels in the pregnant women, we can go further to look at source analysis. Where are they getting this from? And so that we can begin to design source-specific interventions to begin to address the issue. So in brief, I know I've exceeded my 10 minutes. In brief, this is something we've put together. There's so much that Pure Earth has been doing with the Ghana Health Service in Ghana, UNICEF. Now USAID has also come on board because they've realized that lead poisoning is a huge issue. Just recently, UNICEF is focusing on the 5-year plan to address lead poisoning in children in particular. So I think this is the time for all of us to join hands to focus the lenses on the maternal health as well and see how we can begin to diagnose the situation. I'll stop here and pause. If there are any questions, please feel free to ask. Other than that, I'll be here till tomorrow.
Thank you very much, Mr. Esmond, for the enlightenment. So we'll take questions. We'll use 5 minutes to take questions.
Thank you, Reverend. Policy on this. The evidence is clear. Thank you.
Thank you very much. So now that the scientific report is out, the plan is to organize community result dissemination event and also plan to withdraw those cookwares because some of them are so high. Currently, we are also collaborating with the public basic schools who are implementing the school feeding program. And we are doing assessment to also withdraw the cookwares that are higher concentration. And we are scaling it further to conduct a leachate test to see how the lead concentrations in the cookware can actually leach into the food. The previous study, we sent the pots to the US. They did this assessment in their laboratories. They used a certain simulation, and they realized that this can actually leach. But we want to do it locally here. I think all the countries where we operate, they are also doing it locally to ensure that, to be able to ascertain that, yes, this is actually happening. But for now, community engagement, we are educating the public, and we are withdrawing those cooking pots. There's a whole study of analyzing how these whole pots are manufactured, and we earmarked all this, and we are following up with them. So there's another project that may come in to address this as well. Welcome.
Okay, thank you. So you said you are working on withdrawing the cookwares that they use. So what are the alternatives that you put in place? And then my second comment or question would be, you showed a picture where we have babies or a baby that the mother has used something on the eye. So what are the plans in that regard? Those of us who are from the north like this is very common. So what are you going to do so that at least even if they don't stop, these incidents will be reduced?
That's a good question. So the cookwares, look, the best option is to use the stainless steel. We know that these are very expensive. The non-stick is the best way to go, but they are very expensive. So what we are doing is to conduct a value chain analysis of the various manufacturers, which I did mention that we are doing now, to see those that their limit of lead concentrations are low. And this is something that EPA is joining hands with us to do, to be able to map this out. And also working with Ghana Standard Authority to set standard. I think there are no standards currently, so that's a bit of concern.
Coming to the Chilo, the eyeliner, I'm happy to say that we are currently working with USAID on a path to address that, to conduct what we call a value chain analysis. We understand that this is coming outside the country, and so it requires a multifaceted approach to addressing it. But what we need to do now is regulatory strengthening. Ghana Standard Authority setting up the standard of what should be the lead limit in the Chilo that people are using. And I mean, it's religion, it's part of their life. You can't ask them to stop. If you're asking them to stop and you don't find alternatives, how do you address that? So that is the essence of the project that is coming up, to conduct a study, a value chain analysis, discover those ones that have higher lead concentrations and those that do not have lead, so we can offer them an alternative. Because if you go and tell them, please stop using them as a blanket, they will not listen to you. So the good thing is to do a study and then let them know, offer an alternative. Whilst we also work with the regulatory authorities to establish standards. So Ghana Standard Authority, Food and Drugs Board, EPA, they are all involved in that leg of study that will be coming up soon.
All right. Can I go ahead with my question? Congratulations, Reverend Doctor. I think this is a very excellent presentation. I'm interested in whether, I don't think I got it clearly, but whether you have studies that have determined the levels of lead, especially in newborns. And now that you can see we already have high levels from our cooking wares, are there chelators in the form of some maybe medicine or something that we can give to, let's say, pregnant women and children for that matter,
right,
so that even as we try to get lasting solutions, we also try to stop people from getting the side effect or the bad outcomes from this lead.
Right.
I don't know what you are doing about that. First of all, is the levels, and then secondly, if you are planning to get some chelators in the form of some medication or something that they can take frequently or regularly to minimize the levels. Because you mentioned that any level is not safe, so definitely regularly to minimize the levels. Because you mentioned that any level is not safe, so definitely whatever level they have is probably causing some form of issue, especially when it comes to the brain. Thank you.
Yeah. Thank you very much. That's a very good question. Ghana Health Service is a party to this study. And they conducted Dr. Carl, if you know him, the head of the occupational unit. He was directly involved as the program manager from the Ghana Health Service side. So all the children under 5, including the newborns, participated in the study. And 53.7% have more than 5 microgram per deciliter. In fact, I'm very careful because the results are yet to be officially declared in this. In fact, that is a level that the test kits would give you, which means some may even exceed. So that's a cause of concern. Same, remind around where we have the lead contaminated site. It's a huge issue there. The northern region is a huge issue as well. The good news is that our partners, UNICEF, last year met with the Ministry of Health, their technical committee. I think there was a bit of delay in approving some drugs. But I think my last check with them suggests that the ministry have actually approved some drugs. Just yesterday, before coming here, I sent an email to the health specialist, Dr. Chidamanteng, to find out what is the status of that, because they want to go to the communities if they have the drugs available. So something is being done by the Ghana Health Service and the UNICEF. But I think the the Ministry of Health, what I can confirm is they have approved some drugs for the chelation treatment for now. Okay.
So, thank you so much. Let's put it together once again.
There's a hand there.
For Dr.
There's a hand here. Somebody is here. Okay.
You see, I have a conflict here. This was supposed to be the last question. However, you see, two people already raised their hands. But one of the persons that has raised their hand, I will have a problem. So, Salim, and you understand me. You ask your question.
Doc, thank you very much for your presentation and the work you are doing. I want to find out whether your studies had anything to do with whether some parts of your work involve checking the eyeliners we use, women use, makeup, the content of lead in it. Yes.
That's a good question. I don't want to put fear in you, but the 7% you saw there for cosmetics, most of them are those things the women apply. The thing about lead is that it is malleable, and so it can easily be mixed with anything. And it shines as well. You will be shocked to know that people add lead to spices. Yes, people add lead to spices. There is what we call an oxidation process to convert the lead into powder form, and that is how it is put into paint. You know, it's of course, thank God, now we have eliminated lead in gasoline. I think Ghana did that in 2004. But the focus areas now is lead in paint, lead in spices, lead in cosmetics like this. So we need to be careful of whatever we are using. And that is why, for us, one key thing for us is regulation strengthening, working with the EPA, the Ghana Standard Authority, Food and Drugs Board, to pick some of these things up. Even US, they are still battling with lead poisoning. How much more a country like Ghana? So we know and we agree that a lot needs to be done. We focus on children. It doesn't mean the population is not affected. I think pregnant women could be in Ghana, could be a potential source exposure way for them, which we need to study and ensure that it's not contributing to it. Unfortunately, with all respect to Ghana Health Service here, we don't have the equipment to test for lead. So even what we use here, we have to import the test kit from the US, and then we have to conduct the venous test in here. And even that, the challenges we had in confirming the result is a big issue. So I think it's something the Ministry of Health has shown interest, and we are not stopping. We keep collaborating with other agencies. And good news is that USA has made this a big issue now. And so we are sure of funding coming in to support various governments to address these issues.
So thank you so very much, Esmond. Thank you for that very enlightening presentation. For listening to you, the accountants will say, the only good outcome I'm seeing out of this is that we may save some money on the cosmetics. Yes, and for me, it's a plus for us. Yes. So at this point, we'll watch a second video, which will be a documentary series, a very short one. Okay. So while the technical persons are still trying to put it together, I see the conversation around lead is really interesting. Like I said, I'm really worried. You know, Eastern region in particular, because of the menace of the galamsey, I'm not saying lead may be responsible, but for some strange reason, our numbers when it comes to preeclampsia, you know, it's just going up and up. You come on the ward, and literally every woman on admission has preeclampsia, and is getting even worried. Like you said, it will be interesting to look into that to see what role has lead played in contributing to that as well. So, I think my technical persons are ready with the video. It's a very short video, 8 minutes. The longer version is available on YouTube, our YouTube channel. And that's about 30 minutes. It gives details.
The woman, inarguably the most complex and wonderful being on earth, the woman. Inarguably the most complex and wonderful being on earth. Graceful and yet determined and resilient. Graced with the amazing ability to form life within her, a gift to the joy of many. While the process through pregnancy and childbirth may look simple and spontaneous, it's not a giving, and certainly a period of prolonged waxing and waning distress. The experience ends in unpredictable outcome that ranges from healthy mother or baby, life-threatening to mother and or baby, and even fatality. Conditions associated with high blood pressure during pregnancy are among the leading causes of life-threatening and or fatal outcomes for the mothers, and severest form of HDP that, in addition to the presence of high blood pressure, is characterized by symptoms or signs of damage to another organ system, most often the liver and kidneys. Preeclampsia is diagnosed when pregnancy-associated deaths, and thus contributes substantially to the maternal mortality ratio of 308 out of every 100,000 lives birthed in the country. Preeclampsia is the severest form of HDP damage to another organ system, most often the liver and kidneys. Preeclampsia is diagnosed when blood pressure rises and evidence of other systems damage occurs after 20 weeks of pregnancy. If undetected or left untreated, preeclampsia can lead to serious, even fatal complications for both the mother and the baby. Although signs here is the ultimate delivery of the baby and the placenta. If a woman is diagnosed of preeclampsia at a gestational age gestation, the maternity care provider and the woman work together to decide the best way to manage the pregnancy in a way that optimizes the outcomes for both the mother and the baby. This often requires close monitoring and prompt intervention when the need arises. Some of the hallmark signs and symptoms of preeclampsia.
Right. So, thank you all so much. Unfortunately, you know, I told you there were two videos, and the two videos look so much alike. He was actually going to make us watch a 30-minute video. It was the grace of God that made me detect. So I've asked him to play the 8-minute video. So it's the 8-minute video he's coming to play now, and then make progress. So we'll watch the 8-minute video. Thank you.
Please, can it cause preeclampsia in non-pregnant men and women? No. Doctor, I thought it can cause. I wanted us to write for some time.
Giving, and certainly a period of prolonged waxing and waning distress. The experience ends in unpredictable outcome that ranges from mother or baby, life-threatening to mother and or baby, and even fatality. Conditions associated with high blood pressure during pregnancy are among the leading causes of life-threatening and or fatal outcomes for the mothers and their babies. Meet Ajwa, Hannah, Araba, and Philippa, the brave women, ambassadors of preeclampsia, who have decided to share their stories with the world to impact, inform, and encourage all women dealing with preeclampsia, knowingly or unknowingly.
I'm 35 years of age. I'm a businesswoman. I have 3 lovely children.
I'm 32 years old and I work with Electricity Company of Ghana.
I'm 36 years old. I'm a geologist.
I'm 33 years old. I'm a midwife. I'm married. I have 2 sons. I was working at first as a community health nurse for 10 years now before I went to school.
In terms of my health, I've always been prone to high blood pressure.
Grow up, I don't do anything until my delivery time.
It was a very joyful journey to know that after 5 years of being pregnant, I think I was so excited.
I was always going to work. Everything was okay.
So for the first child, my BP was high at 40 weeks. The second one, it was at 38 weeks. 2 years after, I got pregnant again. And it was the normal healthy pregnancy. I wasn't sick, nothing.
I went to work one day, feeling all tired.
Months pregnant. I realized that anytime I was going to work, even before I wake up, I'm already tired.
But at some point of the pregnancy, I realized that I wasn't well. So we went to one hospital. We met the doctor and the nurse, they checked again. I saw that it was high, but they still insisted I needed to rest.
I got to the hospital. They didn't really say anything much. They gave me some fluids and referred me to the main hospital, which was Colib.
Now, with my second pregnancy, it was going pretty well. And then sometime in July, I got COVID.
So it was like
me. So I started reading about it.
It never occurred to me that at 28 weeks I'll be admitted in the hospital.
And then I complained of epigastric pains, and then immediately they prepared me for emergency cesarean section. And that was how I got my firstborn.
Nobody told me about preeclampsia. So I was admitted on Thursday until Sunday dawn. A doctor comes in around 1 a.m. and asks, where is the lady with the severe preeclampsia? And the nurse pointed at me. So that's when I realized what was actually wrong with me. I was wheeled to the theater and I was delivered of my baby. And she was the most beautiful thing I could see.
It happened again. I started having the BPs, and then this time around there was, you know what's happening to you already, so you have to really help yourself while we also help you. So 37 weeks, they did another cesarean session for me.
And then here comes my doctor on the 26th of September around 11, and then it goes like, so after looking at this, your vitals were improving, your protein went down, but then we saw a reverse trend, so we are coming to take baby out. I was like, what?
Just checking the heartbeat of the baby, they told me they couldn't feel anything. I didn't believe the scan they told me that the baby was lost. I told them my baby wasn't dead. I still didn't believe that at 32 weeks I could just lose the baby, whereas in the morning I could feel this baby moving. So the next day, that was when it hit me. So I told myself I would never ever get pregnant. During COVID, I conceived again. So this time around, knowing all the high dangers and everything, I took all the necessary precautions.
Now, if there's a lot more education out there, especially for those like that are not very educated, you know, doing it in our local dialect the doctors giving more information out there, aside from those of us who like to read and even call our colleagues or our friends who are doctors and nurses to ask questions, it would really help.
If I just go and tell you +1, you never understand them.
I had had 2 children already, and I had never heard anything about preeclampsia.
As a patient organization whose founding was inspired by a 4-time survivor of HDP, APEC Ghana endeavors to educate, inform, and advise the public, especially pregnant women, about the prevalence, nature, and risk of hypertensive disorders of pregnancy, notably preeclampsia. APEC Ghana, saving precious lives.
Thank you so very much. Each time I've seen this video,
Go and tell you +1, you never understand them.
I had had 2 children already, and I had never heard anything about preeclampsia.
As a patient organization whose founding was inspired by early pregnant women about the prevalence, nature, and risk of hypertensive disorders of pregnancy, notably preeclampsia. APEC Ghana, saving precious lives.
School of Medicine. School of Medicine Dentistry with MBCHB in 1991. Over 20 years, 30 years. Yes. 1991, please under from University of Ghana, School of Public Health, and a fellow of Ghana College of Physicians, Public Health, clinical fellow of Joanna Briggs Institute, University of Adelaide, South Australia.
And we are very, very grateful for all the education. Over to you.
Thank you very much. School of Medicine. School of Medicine Dentistry with MBCHB in 1991. Over 20 years, 30 years. Yes. 1991, please, of Ghana, School of Public Health, and a fellow of Ghana College of Physicians, Public Health, clinical fellow of Joanna Briggs Institute, University of Adelaide, South Australia. Prior to his current position as Regional Director of Health Service in Ashanti Region, Dr. Tinkran had worked in various capacities in the Ghana Health Service, including Medical Superintendent 1993. So I'm just doing the calculation. In 1991, District Director Service from 1993 to 2001. This great man was born a leader, and he's actually a great leader. Deputy Director Public Health for Eastern and then Bro Ahafo intra-regional from 2001 to 2013. Acting Regional Director of Health Service, Bro Ahafo, from 2010 to 2011. And Regional Director of Health Service, Western Region, from 2014 to 2017. With a resounding clap, let's do that. Please, let's welcome our keynote speaker, Dr. Emmanuel Tinkran.
is that if you are trained in anesthesia and you can intubate, then you can provide advanced life support. And that's what
challenges and then the solutions in addressing hypertensive disorders in
So, thank you so very much, Director, for plans that hopefully we are going to implement to improve on maternal health outcomes in Ghana. I am particularly excited about trying to tailor the interventions, looking at the deaths and tailor interventions to specific localities so that we don't generalize all deaths and then try to develop interventions broadly. I'm also happy about the ambulance, the air ambulance, and I'm praying that that would cut back on the time, because sometimes you clearly will see that there is a genuine delay. Roads are terrible, and even recently we've heard where our roads, an ambulance was attacked. You know, if you have an air ambulance and you're able to prevent all of this, this would be very, very helpful. So at this point, I would like to invite back on stage Professor APEC Ghana to give us his closing remarks.
Thank you very much. It's been a very exciting session so far. We started with power. Someone took us through the journey of eclampsia, a very emotional one indeed. And this tells me that the problem is real. We are not just talking about some statistics. It's not about numbers. It's about real mothers who are our sisters, our daughters, our nieces who are going through this. And then we had a research findings from Dr. Islam Fansa, which was also very enlightening. In fact, I have learned something today. I've always known about lead and the fact that lead is poisonous. But I didn't know about the connection between lead and hypertensive diseases in pregnancy. Today, we've been made known to us that lead can cause preeclampsia. He has also taken us through the sources of lead in the environment. Hearing about chilo and its high content of lead. I think from here we all have to be health advocates. Go out there and educate the community about some of these things that we use on ourselves. I was asking Rita, I asked for that the same, how can we go away with this? How are we going to eat our bamboo and our cake and our appetite? You watch a video of the survivors. One of the phrases that went through those that we listened to was, nobody told me about preeclampsia. I never knew about it. They took my blood pressure, gave me some medicine, gave me some infusion, and then I went home. Please, as health personnel, let us try to educate. Tell the woman what your experience is. Sometimes show them some YouTube videos for them to watch so they understand what is at stake. So education is key. Our regional director has taken us through hypertensive disease in pregnancy. He told us that it's a major cause of maternal and neonatal mortality. He showed us where the disparities are. The referral centers, we don't have them. Infrastructure, equipment, medications, something that we have to start thinking about. He said that time is of essence. But more importantly, it's about the diagnosis. This young lady, epigastric pain with headache, was given an antacid medication. Diagnosis is key. Once you're able to diagnose, you solve about 50% of the problem. You'll be able to refer immediately. Ashanti region, he's told us about our maternal mortality. Last year, about 216. 25% are due to hypertensive disease pregnancy. It's also giving us some solutions. And number one that he mentioned was advocacy. And I think this is one thing that we are taking over. We need to be health personnel who are competent with health advocacy. What we have heard today, what we have learned today, let's go out there and educate the mothers out there. Don't want them to end up as maternal mortality. Don't want to add them to the numbers. And as I mentioned, together we will be able to do it. The Regional Director mentioned that all pregnancies, about 15%, will end up in complication. But then, with the right infrastructure, right health personnel, right medication, prompt referral, you will be able to manage these complications. So, it's not all right. Let's all come together. Let us work together as doctors, as nurses, pharmacists, lab personnel, and then health advocates. Let's put our hands together and be able to have a country which is free of maternal death as a result of hypertensive disease pregnancy. On that note, I want to thank you very much for your attention and staying through this session.
Thank you very much. The ending remarks said that thank you all. So the job is done. The plan of coming up here to give the vote of thanks, but our prom chair has done it for us in a very nice and very simple way. So at this point, nobody is going to blame us for not thanking him or her. But the only person who we need to thank at this moment will be our prop chair, because he's already thanked all of us. So prop chair. But we want to do some top up with it. Thank you. Thank you very much. So we have thanked our prop chair. We want to also acknowledge and then thank our regional director of health service. All our partners, God bless you all for all the support. Pure Health Initiative, Pure Health Black Men Initiative, we want to acknowledge and thank you in a very special way. When I said all our partners and collaborators, I'm talking about sports, I'm talking about CAT, I'm talking about KNUST for even giving us this nice auditorium. And then a very huge and indescribable thank you goes to you. You cannot mention your name. God bless you for being patient and participating in this wonderful session. We know that tomorrow will be another great day and you'll be here on time to grace the occasion. Thank you to my co-moderator.
Thank you to you.
And then our technical men, you've been so wonderful. We have online presence and we want to thank you all for staying through with us to this time. We acknowledge you all. At this point, we'll be closing very soon. We started with God and we want to end with God. When we are done with the prayer, as soon as we say amen, please, we'll all humbly move here to take a group picture. Please, don't be left out. We know some people are photophobia, but don't be a photophobia for this particular program. So we call on our sister Amaris to give us a closing prayer. We are grateful for taking this occasion a success. We give you all the glory, and for bringing us to our destinations safely and bring us back here tomorrow for another powerful program session tomorrow. We thank you. We give you all the glory in Jesus' name. Amen.
We'll have a picture session now. Thank you.
C'est tout.
We are closing all doors.